Hello followers, today we're going to talk about dentures. If you have dentures, full dentures, all acrylic, this is going to be a topic you're going to be very interested in. Hi, my name is Becky. I'm with Restart Hygiene. I'm a dental hygienist and I love to educate you about teeth, your gums, how it affects your whole body health, so stay tuned. So we're going to talk about dentures today. If you have dentures, you know a certain amount about them already, I am sure. So a little bit about dentures is dentures replace missing teeth. So if your natural teeth are pulled or knocked out, you can get dentures to replace them. We have many options these days that we didn't always have with implant supported dentures, which is a good option. But most people at this point still go for regular old dentures. Now these dentures, when your teeth are pulled, they rest on your gums. So resting on your gums means you have to have some bone support under your gums in order to support these, or they will not stay. So dentures are made out of acrylic. The teeth are made out of acrylic or out of porcelain, but most of the time they're acrylic. That's a cheaper model. If you had porcelain teeth, that would be much more expensive. But acrylic teeth are the standard of care, and these can be made by your dentist, and you have more teeth again after you lose them. So dentures would replace all of your teeth. These are not partials. These are full dentures that we're talking about today. So there's no metal on these. It's all soft acrylic material. So if you are getting dentures, then you would be interested to know, if you're having teeth pulled, that you want to talk with your provider, your dentist, and see if they want to pull the teeth and place a denture at the same appointment. That is standard of care normally for most of the time, because these dentures would act as a band-aid to your gums. So you would have something to protect them, and that would help your healing process. Now, if you've had a pair of dentures before and you're getting a new pair, that can be a challenge as well. The reason being is you already have a perceived notion of what the old dentures feel like, they look like. When you try to duplicate that, that is very difficult. So be patient with that and understand that it is a process. Now, having said that, when you go in to get dentures, it is a process. It's a more than one appointment. It's not a one and done. You go in and you have impressions done. You come back, and from the lab, there's a second appointment that's called a try-in or just a viewing to make sure things look good. If you can try them in, that's helpful. But if you can't try them in because you're going to have teeth pulled, you want to make sure the teeth look like what you have now, if that's what you're going for. If you want to upgrade and change your style and look, then you definitely want to let your dentist know that as well. A good idea to do is bring a picture in of when you had all of your teeth if you want to match up what you had before. So that's very helpful too, is to find an older picture with your natural teeth, what they look like, so that the dentist can remake something as close to that as possible. So that's important too. So cleaning your dentures. Cleaning your dentures is very important. Now, a few fun facts for you to know is that your mouth still gets bacteria, so your dentures still need to be cleaned. Your soft tissues still need to be cleaned. Your tongue, your cheeks, your gums, they still need to be brushed every single day. So we want to make sure that you're doing that as well. If you've got an existing pair of dentures, you know you're supposed to take them out and let your gums rest for at least 4 to 6 hours a day. That is very, very important. Now, if your if your dentures bounce around on your gums, so if you're wearing your dentures and when you chew, they bounce or juggle up and down on the gums, and you require to have a fixodent type of adhesive material, then you likely need a reline. And what happens is your gums recede. So if you have teeth growing, you have natural teeth or an implant, it helps keep that bone stimulated and it keeps growing up. When those teeth are pulled out, that bone slowly degenerates. It goes away. So over a period of time, years and months, you can lose bone support and it can cause your dentures to be ill-fitting. So it's important that if they are ill-fitting, that you have your dentist check them and have a reline done. Now, this one can be done in-house. Sometimes it can be done right in the office. Sometimes it needs to be sent to the lab. So be prepared that you may not have your teeth for a day or two if you have to have a lab-aligned denture. Sometimes an option is to go to your dentist's office, them take the impression, you hand deliver it to the lab, and the lab is able to make a reline for you at the same day. This has to be coordinated ahead of time. So these are questions you would want to ask your provider to see if that's an option. Otherwise, you may be without your teeth a day or two, which is not always good. All right, so moving on. How do you clean your dentures? So we talked about that just briefly. You want to take your dentures out of your mouth for at least 4 to 6 hours a day. You want to soak them in a bath with some kind of Effordent or some kind of cleaner that's for dentures. Let them soak overnight is the ideal process, but when they're out of your mouth for that 4 to 6 hours, let them soak. You should have a denture brush. It's going to be a smaller headed toothbrush. You can use your natural toothbrush. I was always taught to use a little bit stiffer brush, maybe a harder brush than your natural soft brush, not the ones you brush your gums with, so a different brush. And you want to brush those dentures when they come out of the denture bath after they've soaked for a few hours. That allows the bacteria and the plaque to be softened up, so hopefully you can remove it when you're brushing your teeth. Do you want to brush the front sides of the teeth? But you also want to brush the insides of the denture where it fits onto your gums. So this is very, very important. Now, if you've ever broken a set of dentures, I wish somebody would have told you this sooner. When you go to clean your dentures, put some water in the sink, plug the hole so there's some water standing in the sink. So if you drop your denture, it doesn't break. You know how many times that has happened in my 30-year career? A lot of times. So put some water in the bottom of the sink. That way, if the denture slips out of your hand when you're brushing it, it's protected and it won't break as easily. Okay? Now, that will keep your teeth healthy and stain free most of the time. But if your teeth do tend to get stained, I was talking to a senior group this past week, and they were mentioning that the coffee and other things that they drink stains their dentures. So the recommendation would be to take some cold water, mix it half and half with white vinegar, soak your dentures in that for a little while, let them soften up, and then brush that away. I wouldn't let it soak for more than 30 minutes to an hour first to see if that's enough to remove it, but cold water and white vinegar are very antiseptic and will clean some stains off. The other thing to do is take a little bit of baking soda and peroxide with a soft toothbrush and just gently brush the teeth. Now be careful not to erode the teeth or put any scratches in the teeth. If you brush them too hard, then you can hurt the denture and you can damage it. So be very, very careful with that. And it's A-okay if you check with your provider to make sure it's okay with them to give you specific instructions on the material that you have. I'm not sure what kind of material you have. This is just a general overview for most denture products. All right, so some tips before I let you go to clean your dentures is you want to make sure that you brush your cheeks, tongue, lips, and cheeks every single day to remove the bacteria. Please have a checkup with your dentist yearly. Even though you don't have natural teeth, we still need to check your oral cancer. We want to check for oral cancer, I should say. Lips, cheeks, back of your throat, nodules down here on your throat. And we take a panoramic. We take a Panorex every 3 to 5 years to make sure there's no lumps, bumps growing underneath your gums. In that bone, you can have small lumps and bumps. And so we want to be able to see that. Also, what we have seen over the years, as you get older, you may get blockages in your carotid artery, which you have one on each side. If there's blockages big enough or thick enough plaque in your arteries, we can sometimes see a hint of that. And that could be a screening tool for us to help you as well. So that's good information. As well as always put water in the sink like we talked about when you're brushing your dentures or you're cleaning your dentures. And also clean your dentures in cold water, not hot water. That's really important. Don't use whitening toothpaste on your dentures. That is always a no-no. That will scratch your teeth and that will cause them to be damaged. You don't want to do that either. And the last thing is always let your gums rest for 4 to 6 hours a day. That is so very important. It's also important for you to know as we get older that it's important for our nutritional needs to be met so that our mouth will stay healthy. So we want to make sure that you're getting good nutrients. You're able to eat your foods with your dentures. This is really, really, really important so that you can stay healthy. So I hope this helps you. Definitely check with your provider if you have any questions before you use materials. You don't want to do anything to damage your teeth. But I know that these will help you, and this is the advice that I give my patients every single day. Hope you have a great day. Thanks for tuning in, and we'll see you next time. We'll be talking about partial dentures next time, and stay tuned. Thank you, Becky Restart Hygiene.